Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. Real glad that you could join us again. You know, it's estimated that 1 in 15 people here in the United States will receive a diagnosis of Parkinson's disease in their lifetime, now often causing symptoms of loss of movement control, like shaking, slowed movement, and stiffness, among others. But a high-tech therapy known as deep brain stimulation can offer some relief for many patients. Well, joining us now during Parkinson's Awareness Month is Dr. Shahed from the Icahn School of Medicine at Mount Sinai, along with Jeff, who she treats for Parkinson's disease. Welcome to Health Professional Radio, both Dr. Shahed and Jeff. Thank you for joining us this morning.
Thank you.
Thank you.
Dr. Shahed, give us a bit of your professional background, if you would.
Sure. I'm a movement disorder specialist. That means I'm a neurologist that has specialty training in the treatment of patients with Parkinson's disease and other movement disorders, and I work, as you mentioned, at the Icahn School of Medicine at Mount Sinai in New York City.
And Jeff, if you would give us a bit of your background.
Well, I was a dentist for over 40 plus years, and I had to retire after the Parkinson's.
Dr. Shahed, what exactly is Parkinson's disease? I mentioned some of the symptoms. Could you go into deeper detail, please?
Oh, absolutely. So Parkinson's disease is a brain disorder. It's a neurologic condition that unfortunately tends to progress over time. And so the symptoms that it usually causes for patients are related to movement, just like you mentioned, Neil. People will often experience things like tremors, stiffness of their muscles, slowness of their movements, difficulties with walking and balance. And the real challenge here is that these are symptoms that can start to affect patients in just about everything that they do in their daily life. So simple things that we often do without really thinking about it, like walking around the house or maybe getting ready in the morning, even sitting down to try to enjoy a meal. These become increasingly challenging for patients with Parkinson's over time. And so Jeff and I are really pleased to join forces today with Medtronic to bring awareness about this condition and talk a little bit about the treatments that are available. And the good news is that even though there isn't a cure for Parkinson's disease, we do know that there are a number of different medications and even some surgical treatment options that can be quite effective at controlling symptoms and also improving quality of life for patients with this condition.
Jeff, as a dentist, the onset of symptoms must have been quite alarming. Talk a little bit about some of the major challenges that you've faced related to your condition.
Well, after the diagnosis, they tried medications, but they were unsuccessful. I would have problems bringing coffee to my wife because of the spilling. The tremors and the stiffness were really becoming a problem. It would drain my energy, and I couldn't even play 9 holes of golf, which was my love. Mm-hmm. I did some research, and I looked into deep brain stimulation, and I found Dr. Shahed.
Now, just to be clear, none of these difficulties concerned any cognitive functions, correct?
That's correct. I hope I still have my mind.
Yeah. Well, Dr. Shahed, Jeff mentioned deep brain stimulation, something that he discovered during his research. What is it, and how does it help people with Parkinson's?
Yeah, so deep brain stimulation, or DBS as we call it, is a surgical treatment for Parkinson's disease. It's usually something that we think about recommending to our patients once they have been taking medications for a period of time but are no longer experiencing the degree of symptom relief that they need in order to get through their day. And so the way that this treatment works, it's like a pacemaker. So people have a battery that's implanted into the chest. The battery is connected to brain wires that are implanted into those deep brain structures that control movement. And we program this battery to deliver a small electrical current, and once that current reaches those deep brain structures, then it can really kind of block or override the signals that are associated with some of those symptoms of Parkinson's that we talked about, things like tremor, stiffness, slowness. And all of these things can really dramatically improve just by turning that stimulator on. It's really amazing to see, just like in Jeff's case, that once you turn that electricity on, the things like the tremors and the stiffness just really melt away. One thing that I think is also important to kind of realize is that although Jeff had a great response to this treatment, it's not always right for everyone, and people who are interested in this treatment really need to talk to their doctors about it, understand the risks and benefits, and really understand if they're a good candidate for the treatment.
When you mentioned patients who were no longer getting the degree of relief from medicine, is this used in conjunction with medicine as they discontinue medicine use, or is it used instead of medicine, with medicine being totally absent?
No, that's a really important question. So most of the time, what happens when people are being treated with medications for Parkinson's disease, they start to develop, either they don't have symptom relief, like in Jeff's case where he had tremors that were not really responding very well, or they start to experience problems like wearing off effects of those medications, or maybe the medicines start causing involuntary movements. And when we use deep brain stimulation, it's really to kind of try to target these symptoms that are not being well controlled, but it's not really a replacement for those medications. It helps people be able to kind of manage those wearing off effects and manage those dyskinesias and manage those tremors that are not being optimally managed. So most people, although they can reduce their medications, we're not looking to use this as a replacement.
Talk a bit about a patient who's not a good candidate for deep brain stimulation.
Yeah, no, that's also a good and important question. So Parkinson's is one of these conditions. It starts out mild, but it progresses over time. As we talked about, those combination of symptoms that can happen. But along with that, people can also start to experience symptoms that are not really even responding to the medications anymore. So if somebody has had Parkinson's for a while and maybe is experiencing significant issues with walking or balance, or maybe even has developed some of those cognitive issues, at that time point, maybe they may not be able to get the greatest degree of benefit from deep brain stimulation. So we really have this idea that there's a window of opportunity when we want to intervene with the surgery so people can get the maximum benefit.
Jeff, as far as your deep brain stimulation experience goes, were there symptoms that immediately dissipated? Were there some that hung around, or were all of your symptoms addressed to your satisfaction?
I was very lucky. I was basically tremor dominated, so that the DBS surgery really took care of my major problem. So I had no problems with it, and it was just a panacea for everything. Other people may not be, as Dr. Shahed said, good candidates for this.
Yeah, or they may have symptoms that, for one reason or another, may be harder to control with stimulation.
Normally, when do these symptoms of Parkinson's present? Do they usually come later in life, or does it matter?
Yeah, no, Parkinson's is definitely something that comes on as we get older. The majority of patients are showing up either in their late 50s, early 60s with symptoms, so we really think about it as affecting more predominantly people over the age of 60. We also know that men are sometimes a little bit more likely to develop this disease than women. There are, in some cases, some genetic components to this. It's a small proportion of patients, but there are some families that have a genetic predisposition for this condition.
Now, April's National Parkinson's Disease Awareness Month. Are there any myths about Parkinson's that you'd like to dispel?
So I think one of the important things for people to realize is that it's not your grandfather's Parkinson's. There has been a great deal of increased understanding in the symptoms of Parkinson's disease, which things are related to the disorder or not. Also, a better understanding of how to use the medications that that are available to us. And as I mentioned before, there are a variety of different medications that can be used in combination. And if at any point those medications are starting to look like they're not working as well anymore, again, just like in Jeff's case, then we really have the option to offer deep brain stimulation for patients.
Well, Dr. Shahed, we'd like to learn some more about Parkinson's and about the available treatments. Where can we go online and learn some more?
Yeah, there's a great website called discoverdbs.com. You can go there to find not only information about deep brain stimulation, but also to be connected to a movement disorder specialist who may have experience with this treatment modality and also in the management of Parkinson's disease.
Well, Dr. Shahed, Jeff, I thank you both for joining us here on the program this morning. Thank you. You've been listening to Health Professional Radio. I'm your host, Neil Howard. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download at SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com/Health Professional Radio.